Organization called the National Committee to Preserve Social Security and Medicare. Good morning. Thanks for joining us.
Good morning, Steve. Thank you for inviting us.
What is your reaction to this proposal put forth by Senator Reid? We don't have the details. We don't know how much it would cost, but allowing those age 55 to 64 to buy into Medicare. Presumably 3 to 4 million people potentially could do so.
Well, as you said, we don't know much about it, so we have to make some assumptions about what they would end up including in such a package. There have been proposals to allow buy-ins into Medicare for decades, and so we have done some analysis, and the ultimate impact on Medicare really depends on how it's structured. From what we hear, it's not likely to impact Medicare at all, because they're talking about creating a separate risk pool for the people who will be buying in, and I'm assuming that because most of the congressional leaders who have expressed concerns about the public plan expressed concerns that were tied to using Medicare reimbursement rates for providers. And so I'm assuming that this particular buy-in won't use the regular purchasing system that's used in the Medicare program. They'll have to have something different, whether it's a negotiated rate or something, it will be different. So neither the cost piece nor the payment piece will end up crossing over into the existing Medicare program. So we're not expecting it to have any impact on the program itself at all.
But among the criticism that I know you and others have been hearing is that doctors and hospitals that typically get 60, maybe 70% on the dollar from Medicare recipients worry that this could spread to those 55 to 64, and that could have undue harm or serious harm on hospitals, physicians, and who physicians want to treat.
That's why I'm assuming that that's not the way this program is going to work. They will have some other way of reimbursing those providers. They will not base it strictly on Medicare rates. Even the versions of the public plan that they were talking about over in the House were not strictly Medicare reimbursement rates. It was usually Medicare plus some percentage. And then they started talking about negotiations and some kind of negotiated rates. I cannot imagine that they're going to go back to a strictly Medicare level reimbursement rate. It will be some other number or some other mechanism. So you should not have that problem with the providers out particularly in the rural areas where a lot of, I know, rural senators and congresspeople have been concerned about that problem.
Do you think this idea has merit?
Well, it certainly from our standpoint, we think the Medicare program is wonderful. The National Committee represents over 3 million members and supporters nationwide, mostly seniors. They're from all walks of life. And one of the things they have in common, one of the things they share, is their passion for both Social Security and Medicare. So we think Medicare is a great program. Our seniors love it. It's not perfect, but without Medicare, most seniors would not have any kind of health coverage at all. So allowing other people to have some experience with the program, we think can only be a good thing for Medicare, as long as it's designed in such a way that you don't have to worry about who it is that's purchasing into this pool. There's no way of knowing how sick those people are going to be, basically.
Then why not have Medicare for all? Why this debate on health care with various proposals and whether there's going to be a public option or a government sponsor of private health care benefits? Why not just make it available for everyone and keep it simple?
Well, we don't have any problem with that, but you're not starting from a blank slate. You're starting from a healthcare system that has significant involvement of the insurance industry, and they are woven into the fabric of life here in the United States. And so as much public concern as has been raised by the discussion of whether or not the government is controlling the system that's now being included in both of those bills, there's no way you could get a majority public support for scrapping the current system completely and starting with Medicare for all.
But when you hear that Medicare is going broke, what do you say?
Well, we obviously have a great deal of concern over the future of the Medicare program. What you need to remember, though, is that Medicare is a health care program. It is more efficient and it grows more slowly overall than health care generally. But it is still a healthcare system. We use the same doctors, the same hospitals, same MRI machines, same Band-Aids that they use in the non-Medicare population. So when those go up, they drive Medicare costs up also. Not quite as fast as in the private sector, but it's still being driven up. So unless you can get control over healthcare cost growth system-wide, you're going to have a problem with healthcare in the overall economy, and you're going to have a huge problem with Medicare, both for seniors and for the federal government. People tend to focus on the government costs that are associated with Medicare. It's a real problem for individual seniors as well. Most seniors are currently spending roughly $3 out of every 10 of their Social Security check just on Medicare out-of-pocket costs. And that's projected currently to go up to about 50 cents on the dollar in the next 15 years. So it's just simply not affordable either for individuals or for the government to have Medicare growing the way it is, but it's not because there's a problem with Medicare. You have to get control over the whole system, or you end up with providers who simply won't take Medicare patients. If you think the problem's bad now, you keep driving those Medicare rates even lower, like has been proposed with some of these fiscal commissions that some of the senators have been talking about, you're going to end up with serious access problems in a few short years. That's one of the reasons why, as an organization, we've been very intrigued and supportive of the idea of including Medicare in this overall health care bill. Rather than just targeting Medicare and just cutting the Medicare program, this is an effort to slow growth system-wide, so you don't disadvantage Medicare patients when compared with a private pay patient.
Some background on our guest, Maria Fries, who's a graduate of Eckerd University, also earned her law degree from Georgetown University here in Washington, D.C., spending nearly 20 years on Capitol Hill working for a number of Democratic members, including Congressman Payne of Virginia, Congressman Dix of Washington, and Senator Max Baucus of Montana. Who funds the National Committee to Preserve Social Security and Medicare? National
Committee is entirely member supported. We don't take money from any outside organizations. We don't get supported by doctors or pharmaceutical companies or the insurance industry. We are entirely supported by our 3 million plus members who send us $12 a year to represent them here in Washington, D.C.
And a website link available through cspan.org. Tom is joining us from Bunker, Missouri. Good morning with Maria Fries.
Thank you. I'd like to thank you all for having me on here this morning. I got a question there. I'm 53 years old, and I took care of my mom and dad. They both got sick and died, and I really don't have a job. I've kind of been disabled and been kind of taking care of myself here and taking care of property tax, what little I got, and what it takes to just barely eat and get by here. Now, how am I going to pay for health care, this $1,500 a year they're talking about, for us being fined because we don't have any money to pay for this? What little times that I go to the doctor, I pay cash for it, and I pay dearly for it. But why do we need more government in our life than we already got?
Thank you, Tom. We'll get a response.
Well, if you are low income, there are significant subsidies that are included in both the House and Senate version of this legislation. And so the cost of the insurance will be much significantly reduced. And you'll have coverage. Right now, you sound like you're relatively fortunate in not having extraordinary medical expenses. If you did, it would be really hard to keep paying those expenses out of pocket, particularly since it's really hard to plan for them. You never know when you're going to get really sick. So this would give you coverage, and it would end up subsidizing that coverage to a large extent. How much will depend on exactly what your income levels are and what version of the bill ends up getting signed into law.